Good morning, Dr. Bright. A great honor to have you with us. How are you?
Good morning. It's great to be here. Thanks.
Okay, I think first thing first, how would you grade the global response to this pandemic? Was it the best given the circumstance, or we could have done better?
Well, I think the outcome of that question is what we see with the death toll around the world and the economic toll around the world and the societal disruption and the disruption in education and so many important factors around the world is, I would not grade our response very highly. I mean, honestly, we could do much better. We could have done much better, and it's really disappointing. And I hope that the outcomes that we see today will be the energy and the lessons that we need to learn to do a much better job to make sure next time we face a pandemic that we're all better coordinated and we respond better and we don't see as much damage next time.
Yes, we have faced multiple influenza and other viral pandemics in modern history. Why do you think we're not still prepared?
It's really interesting. For the last decade or more, there have been a lot of scores and rankings and profiles to try to say which countries were better prepared or less prepared for a pandemic. And when you look at some of those scores, some of the countries that scored highest as being prepared for a pandemic actually had the worst outcomes in the pandemic response. And some of those that didn't score as high actually did a fantastic job of responding. And it's almost, in many cases, a flip, a reverse. Some of the higher income countries performed much worse than some of the lower middle income countries. And so we have a lot to learn from those lessons. But overall, I think that we've learned that no matter how much we think we're prepared, no matter how many plans we have in place, we have to exercise those on a daily basis. We have to exercise collaboration, and we have to be ready for political interference. And political interference in some parts of the world is never a factor that we put into any of our pandemic plans. And now we know that it can be one of the most critical ones to consider.
Agreed. It's very interesting because in Thailand, for example, during the first wave, we did very well, exceptionally well. But subsequent waves, we got hit pretty hard. So that's very interesting that, it changes the suffering of the country. Actually, it's hard to judge from the scores, I think.
Yes.
Okay, well, let's talk about the vaccine technology and technology transferred. How can we speed that up for the future pandemic?
It's really critical that we have a global expansion of high quality vaccine and drug and diagnostic manufacturing capacity. Many people think it just requires building a factory or putting a building in place, but it's really important to think about the need for a tech transfer, a knowledge transfer of what it takes to make those life-saving medicines and vaccines, and the need to have a highly trained and skilled workforce in regions of the world, and make sure that there's a really good quality system and a regulatory body that can review and approve and ensure the quality and safety of those vaccines and diagnostics and drugs. And another important factor is, we think about these really a lot now because we are desperately in need of them for this pandemic. But we need to think about these in non-pandemic times and non-critical times. So when we build these capabilities, we have a way to sustain them. We have to use them daily. So the entities, if it's Gavi or governments or UNICEF that procure or buy vaccines for use around the world, when we have more vaccine manufacturing capacity in developing countries or more regional places around the world, we have to buy from those companies to make sure that they're sustainable and they're always in place and that workforce is in place. So when we do see a crisis such as we're seeing now, that those capabilities are in place and that workforce is in place and the quality systems are in place so we can respond much more quickly.
Who do you think should be in charge of this effort? It's local countries would have a hard time doing this, especially developing countries, right? I would think.
You would think it would be difficult, although I was leading a program for over 10 years when I was a Deputy Assistant Secretary for Public Health in the U.S. government and in charge of pandemic preparedness response. And I worked very closely with the World Health Organization to help build vaccine manufacturing capacity in 13 low and middle income countries where many people thought it would be very difficult. And in some countries, it was very difficult. But in other countries, Thailand's a great example, for example, where the government was committed to helping, where you had a really strong workforce and a highly educated population and systems in place to retain and continue training and putting in great quality system and the regulatory system as well, then we made great success. I'm very proud of the success we made in Thailand and about, honestly, about 10 other developing countries where we proved that when there is commitment from the government and that support, and there is that local capability, and there is a commitment to buy and sustain that product coming from those countries, from those factories in those countries, then it can be done. It is possible. We know it's possible. We've proven it's possible. And now we just need to see, once again, the leadership from high-income countries, from the WHO and other important entities to take on the leadership role to continue this important work, expand this capacity, and sustain it. And I know many more places around the world can make vaccines and drugs.
Yes, and I heard that technology to make things like mRNA vaccine is not particularly expensive. I mean, you could possibly buy the equipment, easily, import at least.
It is much less expensive than many of the traditional vaccine manufacturing systems. When we were installing vaccine manufacturing capacity in many parts of the world, it was all based on egg-based manufacturing, and you had to build a chicken farm. You had to have a process for the eggs and purification and many, many more process steps and specialized facilities and air handling systems and such. Very expensive, very complex, and took a lot more staff and personnel to manage. With the new technologies that we have that are recombinant based, messenger RNA, DNA, even live virus vectored vaccines, the simplicity of the technology reduces the cost, reduces the footprint of the factory, reduces the number of personnel needed. So it really does make it suitable for many more places around the world to adopt the technology and also to expand the technology for more than just one vaccine. In the previous days, you have a big investment. You can only get one vaccine out of that technology. Now with messenger RNA, we hope that we can get many more vaccines and monoclonal antibodies expressed from the same technology platform.
Sounds wonderful. Sounds exciting for the future. Well, but at least in the present, with money never being enough, especially for a developing country, how do you suggest we allocate the resources to prevent a future pandemic? Should we go with the testing? Should we go with the treatment? Should we go with drugs or vaccine? Or, I'm sure we should do everything, but, the resource is quite limited.
It's important to do everything, but it doesn't mean that one place or one group needs to do everything. So it's really important to collaborate and have regional capabilities and identify in your network the partners you collaborate with, the strengths of each of those partners, and have some partners focus on vaccine development and regional distribution of that vaccine. Some work on testing and regional capacity building and distribution and therapeutics as well as scaling up production of raw materials. So it's not always just making the drug or the vaccine or the diagnostic, but we need to work with partners that make nitrocellulose for rapid antigen tests, that make reagents for PCR, and make the various components that are used in these. So I think by collaborating, and it does take a lot of money, you're right, but by collaborating, no one group or one country needs to come up with all the money or all the capability. And that's why it's so important. And what this pandemic revealed to us was that importance. It revealed the vulnerabilities and highlighted the importance of collaboration and not putting all of our resources in one thing or in one part of the world.
So every country has their specialty area where they can help, contribute to controlling the pandemic, basically, you're saying.
They do, and there's redundancy. So again, it's multiple parts, countries or regions of the world, and they work together. They don't compete.
Mm.
They don't nationalize a capability. They don't do it in a silo. It's important that there is transparency and collaboration and communication between the different countries and the labs or the facilities in those countries that are making those vaccines. And there's transparency in the raw material supply chain. So when we know there's a shortage of vials or needles and syringes or plastic bags, we're not all looking to the same resource to replenish, that we have a network that is around the world to identify who can specialize in what area. And we have redundancies in case one thing goes down or runs out, then we have a backup plan to make sure we can fulfill those supplies and get the medical materials out that we need.
Well, this pandemic has proven to be an equal opportunist, I would say, because rich country and poor country alike, they suffered. But even then, poorer countries seems to suffer more. I mean, we can see example like India last year was quite bad, I think. But how do we increase the role of a more advanced country helping out developing countries? I mean, there's been example of vaccine and medical equipment donation, but usually, the equipment is not enough, and the timing of delivery of the stuff is never fast enough.
You're exactly right. I mean, again, that's the bad thing that this pandemic has highlighted is this inequities, inequities that we see in science and capabilities and access to life-saving medicines and tools that we need. It also reminds us that the global health security is about regional health security and local health security. So we need to make sure that there is more collaboration between all countries. I mean, what we saw and what we know is to be true, that many of the high-income countries have invested heavily into research and development. So when we have these tools, these new diagnostics or drugs or vaccines or materials to enable the use of those medicines, they're all in those higher income countries because they've invested and they have those at their fingertips. And what we need to see more of is the high income countries recognizing that we're all in this together, and that there's great value even for a high income country into sharing that knowledge and sharing those resources and doing the tech transfers for more countries and low and middle income countries. So there is greater equity, there is greater access to those technologies and those medicines. Many of the things we might develop in a high income country are very expensive. And sometimes they don't think about how even the price or cost of those medicines would translate to other parts of the world. And the other thing is in high-income countries, we often think we can just donate money or donate vaccine and sort of deliver it to your doorstep or deliver it to a tarmac at an airport and claim credit that we've done our part to help the rest of the world. And the help is only beginning when you deliver a supply to a country. We need to continue holding hands all the way through the distribution and the administration process, because we know the vaccines don't do any good on the tarmac. They only do good when they're in people and making that strong immunity in people. And the more we do this in all parts of the world, the safer we are in every part of the world as well. So it is that recognition that donation and headlines and press releases don't end a pandemic and don't save lives, but it is the collaboration all the way to that final mile and that final inch that really makes the world safer. And it's not always just giving information or giving money or giving something, but it is teaching the community on how to help themselves, how to make their own vaccine, how to collect their own data and analyze their data, and creating that space where we can share that data so we're all in the same place at the same time when something global happens to us.
You're so right. I mean, in the beginning phase of the pandemic, we got donations for vaccine from other countries, and it turned out exactly what you said. It was at the airport. It takes time to be delivered, and checked out everything. So it's been weeks, almost like maybe many days before it get into the people So that's a waste of opportunity, I would say.
Yeah,
Hmm.
and honestly, we've learned that sometimes the donations come to your doorstep and they're within days or weeks or maybe even a month of expiration date.
Correct.
So it's not as if you're getting freshly made vaccines and drugs that you have time to implement a complex delivery system that includes a complex cold chain and a complex administration process. You're given weeks or months, if that sometimes, to work through that entire complex process. And in that case, it's really crushingly devastating because you have those materials given to you, but there's no time to put them into effect. And so that makes it almost more excruciatingly painful is not having them to begin with at all. So again, this is where we need to think through the process better, collaborate and be more transparent. And that is where the outcome will be much more effective for all of us.
Totally agreed. Well, so our next question is going to be about public perception of vaccine. I think that's one of the obstacle of administering all these vaccine to the people. You know, sometimes they got false information. Sometimes they're just afraid for no reason, or they talk to some non-medical doctors and they got this funny ideas about vaccines. How do we change a public perception?
You know, it's really unfortunate that this pandemic, and as I said, we have thought about pandemics for decades, but we never consider the impact of politicizing or political interference or political representation of life-saving medicine, such as vaccines and drugs and diagnostic, mask, social distancing, and critical measures to control an outbreak. And what we saw is a really sharp, fierce politicization of vaccines. And that built distrust, that fed distrust and miscommunication around the world. And we haven't been able to stop it. It's only gotten worse over time. And, you know, when I see when I talk to people who are not vaccinated, who don't understand or appreciate the value of vaccine and the vaccines we have today, who don't appreciate the safety and the effectiveness of the vaccine, it is because they have heard the wrong information. They've been, the communication has been from mistrusted messengers, you know, who are spreading false information or fake news. What I've learned is really important is to make sure that the messenger is someone who is people who we need to vaccinate, people who are not vaccinated, who are not trusting the vaccines. We need to find people who they trust. There's so much value in taking the message locally, as local as you can get it, and having the messengers be in the community, speaking in the language. And the language could be a regional language. It can be a very local language. It can be a slang language. But whatever language it needs to be in, that is where trusted messengers play a critical role in reestablishing that trust, in telling the truth about the vaccines. And that information, that approach actually helps more people better understand and appreciate the vaccines than broad media, than political media, than paid advertising around the world that you might see. So I think we need to make sure we take the message locally, and we need to take the messengers from those local communities, give them the right information, and we'll see much more impact in getting people the truth and getting more people vaccinated than what we've been seeing with a strongly political message.
Okay, great advice. And what do you see as the roles of foundations such as yours in dealing with pandemic, especially in the future?
Exactly. In this outbreak, in this pandemic, and in the future, I mean, there is great value that the charitable world, the philanthropic world can bring to a response. And it's important to recognize that, you know, again, no entity can do this alone. It takes all of us. We all have a unique role. Foundations, I've seen in this outbreak, and I've seen preparing for others, can take greater risk. They can move faster than governments. So that one critical role that they play is they can launch pilot products. They can make initial seed investments to get things started, to accelerate the development of drugs or vaccines, or put in supply chains or distribution channels. And they serve as an on-ramp for governments and larger entities then to take over once they have their decisions made, once they have their money in place, so they can then expand and sustain that response over time. And then another critical role that that philanthropies or foundations can play is the ability to convene across sectors. We're neutral. We don't have political constraints. We don't have the same constraints and rules that countries must play and how they must align. And if two countries or a region for some reason are in disagreement and they're not in alignment, there's some political controversy, foundations can be a neutral role, play a neutral role, be a neutral mediator, and bring together the public sector and the private sector and across borders and across disciplines, so we can meld the best minds from those sectors and come up with solutions really quickly. And we can trial different things, as I said, that are more risky and get things started sooner. And then when governments and others have time and catch up and resolve some of their differences, the response has already started. And I think those are two important roles for foundations and private philanthropy.
Well, excellent. Well, Rick, thank you very much for coming on the interview. And I thought your thoughts were excellent and to the point, I think. And hopefully we can use these ideas for the next pandemic. Hope I can see you and talk to you again soon.
Thank you. It's been my pleasure. I've really enjoyed the conference and this discussion.
Well, thank you so much. That was Dr. Rick Bright of the Rockefeller Foundation, and you're watching PMAC Interview. Stay tuned for more, and don't forget to subscribe to our YouTube channel. Thank you.